Good morning, everyone. This is Dr. Alex Vasquez, and what I'm going to focus on in this presentation is talking about the antiviral nutrition protocol that I've developed over the last few years and which I recently republished. And I'd like to talk about how that antiviral protocol can be applied not only to acute infections, but also to long-term, or what we might call long latency viral-induced disease. The reason I'm putting this presentation together right now is because some new research was just published this week which actually reinforced a hypothesis that I published last year, and I'll show you that in just a moment. So what we want to do when we think about viral infections is look beyond acute viral infections that are obvious into looking at these disease associations between these chronic or latent viral infections and long-term so-called autoimmune or degenerative diseases, and what we'll focus on in this conversation is Alzheimer's disease. So last year in 2013, I published a hypothesis discussing the role of these viral infections in the development of Alzheimer's disease in particular. We'll talk about that prediction and we'll contextualize that along with the new research that was just published this week. And we'll have to reconcile that model with ApoE and, of course, with mitochondrial dysfunction, which we all appreciate is a component of Alzheimer's disease. And we'll talk about how to approach that clinically. So to summarize very briefly, the major points for right now are to discuss what I call the TVL, or the total viral load, and that includes exogenous viruses, endogenous viruses, and bacteriophages. And we have to appreciate in each patient how their unique pattern of viral infections not only can express disease as individual infections, but also how those viral infections interact and are combined together to create a different pattern of overall viral expression, we might say, or viral induced disease. So what I talk about when I talk about total viral load is identifying the individual types of viral infections and how those are interacting with each other, especially within the context of the patient's xenobiotic load and nutritional status, which are both important determinants of viral replication. So we all know by now that viruses interact with each other through a process called viral transactivation. And that is, if a patient has more than one type of viral infection, and of course everybody's got multiple viral infections, but viral infections tend to have a cascading effect on each other where one viral infection causes transactivation of other viral infections. We'll look at that in context with some new data that was just published recently on Alzheimer's disease and chronic herpes infections. And we'll try to connect that with microbial-induced mitochondrial dysfunction, or what I call microbial mitochondriopathy. And I first published that phrase in an editorial that I published in 2014 in January in Alternative Therapies in Health and Medicine, and we'll touch on that article in just a moment. I'm sure we're all aware that starting in October of 2014, we just started to see more and more viral infections in the news. Some of these were enteroviruses that started out as respiratory infections and later went on to have a pretty high level of mortality across the United States. And then, of course, we all were just getting deluged on a daily basis with information about Ebola and the international and social and political implications of Ebola as well. So because I had published an antiviral protocol back in 2009, and I had recently updated that in my rheumatology book for 2014, I decided to revisit it one more time and republish it in a digital format so that people could always have access to the most recent version of that protocol. And in that, I again, of course, discuss what I call the total viral load, which includes exogenous viruses, endogenous viruses, and what we now appreciate is the potential clinical significance of bacteriophages, because we see a higher prevalence of bacteriophages in patients with autoimmune disease, especially Crohn's disease. So one of the things I realized as I was revisiting and revising this information is that what we need as clinicians is an overall strategy. And so what I reflected on is that, I've been through 3 doctoral programs and I've read, dozens of medical textbooks and hundreds of articles. And what I've never seen is an explanation or a unifying strategy for how to manage these viral infections. So what I decided to do was reorganize my own work in such a way that it communicated to other people how it is that I approach viral infections. And I'll show you that in just a moment, or at least I'll give you a sample. So let's take a quick look at that. So The new work, which represents the most current demonstration and communication of this antiviral protocol, is Antiviral Strategies and Immune Nutrition. Now, that's the paper version of the book, but if you want the automatic updates, then of course you want to get the digital version, which is Antiviral Nutrition, and I've given you the identifying code for that here. So here's what I'll ask you right now. So take a look at this. What is your antiviral strategy? And I was talking with a good friend of mine in Chicago the other day, and what we were talking about is the importance of having a strategy and having the ability to communicate that strategy. Because what I would say here, and this is, of course, one of the things I've said to my graduate students previously, is that if you can't communicate what your strategy is, then you really don't have a strategy. If you can't communicate it to other people, including your patients, then we could say of what value is a protocol if you can't communicate it to other people. So let's focus here on developing a simple outline of a strategy that you can use, that you can communicate, and that you can use for yourself as well to organize your thoughts and implement a more effective strategy. So this is something that you can download into your computer, your tablet or iPad, and your smartphone, and so that you have this information updated and available to you at all times. So let me show you how my four-part strategy is actually structured. It's with these components that you're looking at on the back of the cover of the book. I divide my antiviral strategy into four components: antiviral, anti-replication, immunonutrition, and cell or whole system support. And you might be surprised, but the data on this is actually quite strong already, and that's how I was able to organize all of this data into a four-part overall strategy where you could organize your thoughts and organize these treatments for maximum clinical effectiveness. So let's look at a few of the titles of these articles. FDA approved selective estrogen receptor modulators inhibit Ebola virus infection, high-dose mannose binding lectin therapy for Ebola virus infection, and very interestingly, papaya leaf juice to increase platelet count in patients with dengue hemorrhagic fever. You'd be surprised how much good research is out there, which could be used when drugs aren't available, or if the drugs aren't tolerated, or if they can't be afforded by whatever population you're working with, or if you want to use drugs and nutrients and botanicals together, then obviously you can do that as well. So again, the focus of today, we're going to look at acute infections, but we're also going to look beyond those acute infections. And what I like to do is look at the research linking these chronic viral infections with degenerative inflammatory diseases, looking far beyond the acute and simplistic models that we all learn in medical school, to understanding how the total viral load, which is comprised of exogenous viruses, endogenous viruses, and bacteriophages, can impact autoimmunity and neurodegeneration, other long-term chronic conditions, and especially Alzheimer's dementia. So I'm sure you appreciate that that research actually isn't very new. If you look at this article published back in 2008, what they showed here was a connection between herpes simplex virus antibodies and the risk of Alzheimer's disease. And likewise, a follow-up study also published in Public Library of Science in 2011 suggested that antiviral drugs could actually be used to mitigate some of the neuropathology of Alzheimer's disease. So based on this and other research, my hypothesis, which I published in 2013 in this very short book, and which I later updated in a much larger book of about 700 pages, was that these chronic latent viral infections actually weren't simply latent and silent. They actually had clinical consequences. And what I proposed in the book was that these viral infections had what we could call a combinatorial effect, which is not simply looking at them individually and not simply looking at them quantitatively, but looking at how they interact with each other. And I proposed that that would have clinical significance. So I proposed a few things in this conversation. One is that I proposed that these viral infections had multiple effects beyond the acute infection, and that when they were clinically latent, they were not pathophysiologically latent. They were still active even when patients weren't experiencing the consequences of those infections. And I think the research bears that out actually quite well, especially when we talk about the role of human endogenous retroviruses in the pathogenesis of autoimmune diseases. Patients with autoimmune conditions don't typically come in with symptoms of a viral infection as we would typically appreciate that infection. What they come in with is pain and inflammation, which we now appreciate ever increasingly as being a resultant of the immune response against those human endogenous retrovirus codes. So I think the two most important points that I made back in 2013 are that number one, clinically silent viral infections are not clinically inconsequential. So, for example, if a patient has herpes simplex virus and they're not experiencing an outbreak, they could still be suffering consequences of that viral infection, especially when we connect that infection with the pathophysiology of Alzheimer's dementia. Number two, what I want us to focus on is appreciating how viral infections work in a combinatorial fashion so that a individual patient's pattern of viral infection and viral expression is part of what creates their clinical picture. So let's think not only of individual viral infections, but how those viral infections are working together to create a certain disease phenotype. And the best example of that, actually the best three examples, I'll tell you, the best three examples of that, according to the research, are scleroderma, Sjogren's syndrome, and lupus. And obviously I discussed that in the rheumatology book. That's a little bit beyond the conversation right now. In this case, I just want to focus on herpes and Alzheimer's dementia. So again, this was just published this past week, October 20th, you can see here, 2014. Herpes simplex virus increases the risk of dementia. This was based on new research that was actually published by several different groups. Journal of Alzheimer's Disease, 2014. Titers of herpes simplex virus type 1 antibodies positively correlate with Alzheimer's dementia. And even though I'm not going to read word for word what I've highlighted here from the original full text article, you're welcome to pause the video at any time if you want to focus in on the text. Let's look at another article. This was published in Neurobiology of Aging, 2014. Herpes virus and Alzheimer's disease, relation to progression of the disease. Again, what we're seeing is the connection between these latent, so-called latent viral infections and Alzheimer's dementia. And you'll notice that in this case, they didn't even test for herpes simplex virus. They tested for cytomegalovirus, Epstein-Barr virus, and human herpes virus type 6, all of which are within the family of these latent neurotropic herpes viruses. So what about ApoE? How do we reconcile this genetic risk with the new research connecting herpes virus with Alzheimer's dementia? Well, you'll find the story very interesting because what the research shows is that patients who carry this ApoE genetic risk factor for Alzheimer's dementia actually have a heightened risk for more severe and persistent and more extensive herpes virus infections. So having the ApoE genotype actually increases the risk for having herpes virus activity in general, we might say, but in particular having that activity confined to the central nervous system and specifically the brain. So this has been published now several times, and again, this helps us understand how this genetic risk factor, ApoE, increases the risk for Alzheimer's dementia via herpes simplex virus type 1, and by extension through viral transactivation to the other viruses that have more recently been implicated. So I call that ApoE reconciliation. It helps us to reconcile how this genetic risk factor for dementia interacts with the environment, and in this case with viral activation and transactivation. Now, if we extend that even farther, this also helps us understand the connection between nutritional status and viral infections and Alzheimer's dementia when we appreciate that, for example, DNA methylation helps to silence these exogenous and endogenous viral sequences, and also we can use nutrients to suppress the NF-kappa B pathway, which often gets hijacked through viral machinery for the promotion of viral replication. So I call this ApoE reconciliation. Now let's look at how we can reconcile the mitochondrial model with Alzheimer's dementia and ApoE again. So how can we connect all of these things together? Well, let's take a look at how we can do that. So I think we all know by now that Alzheimer's dementia has a mitochondrial component. And what I've shown you just in the previous slide is that we can start with a genetic predisposition, the ApoE genotype, and how that interacts with the environment in the form of viral infections. So now we've gone from genes to viruses, and now we're going to connect those two dots with mitochondrial impairment. So what I've discussed again before is what I call microbial mitochondriopathy, and that is how viral infections can impact mitochondrial function in such a way as to lead to not simply mitochondrial impairment, but ultimately the clinical manifestations of that. And so what I'll show you right now from the diagram on the cover of my book is how microbial infections can impact mitochondrial function. So what I had written about before was, again, using this phrase microbial mitochondriopathy and discussing how microbial infections impact mitochondrial function and how that then leads to either cellular impairment or systemic inflammation and other manifestations such as insulin resistance or chronic pain or chronic fatigue. So now we're extending that model specifically to discuss viral infections. And as we can see here, according to this model that I drew per the research, microbes affect mitochondria, and then when mitochondria become dysfunctional, that leads to more oxidative stress and more inflammation, and ultimately more clinical manifestations. So now I'll show you how to connect mitochondrial dysfunction with endoplasmic reticulum stress by showing you a sample diagram which I happen to have placed on the back of the book. So, what I've shown in other presentations is how mitochondrial impairment leads to endoplasmic reticulum stress, and the opposite is also true, that endoplasmic reticulum stress leads to mitochondrial impairment. This is exactly the reason why in the second edition of my mitochondrial nutrition book, I decided to extend the title of the book to include specifically endoplasmic reticulum stress, because I think we need to appreciate how these things interact with each other. And what I'll tell you very briefly here is the relevance of viral infections and viral replication in this kind of holographic continuum between endoplasmic reticulum function and mitochondrial impairment. And it's actually quite simple. So we should all appreciate by now that endoplasmic reticulum has the intracellular responsibility, we might say, for folding and processing proteins. Well, so I'll ask you this question in a Socratic manner, and that is to say, what would you expect to be the consequence of rapid viral replication on the endoplasmic reticulum? You would logically expect that as those viral particles get produced, it's going to put stress on that endoplasmic reticulum, and that viral replication itself is a cause of endoplasmic reticulum stress. And therefore, viral replication leads to endoplasmic reticulum stress, and in that manner, indirectly, it can lead to mitochondrial impairment. So let's, work on connecting more and more of these dots so that we have a better understanding of what's actually occurring. So let's just pause. In this case, I'll pause for just a moment and connect a few dots. I talked about how genetic predisposition through ApoE leads to increased viral replication and central nervous system activity of herpes viruses. We now know that that causes endoplasmic reticulum stress, and that endoplasmic reticulum stress causes a vicious cycle leading to and perpetuating mitochondrial impairment. So I would call that an indirect mechanism through which viral replication causes mitochondrial impairment, and that indirect mechanism is through, again, endoplasmic reticulum stress. Now, I want to show you exactly how these herpes virus infections can cause mitochondrial impairment, because a direct mechanism does exist, and it's actually very, very simple. Let's look at that research right here. Herpes simplex virus eliminates host mitochondrial DNA. And as we probably all know by now, host mitochondrial DNA is what produces the proteins for the electron transport chain. So a consequence of herpes virus infections is destruction of the mitochondrial electron transport chain. So when we talk about all of those things occurring together, if we look at the right-hand side of this diagram, you can see how I've structured this diagram to go from cellular viral infection to gene transcription, the effect that nutrients have on gene transcription, and then the ultimate consequence on an intracellular level, which again, if you'll look at the right-hand side of that diagram, will start with mitochondrial impairment, and then we go to endoplasmic reticulum stress, and as I've already communicated to you, those interact with each other. A lot of times when we think of the consequences of viral infections, we just think of the immune response, but we need to start thinking in terms of mitochondrial impairment and endoplasmic reticulum stress, which again is why I've extended my mitochondrial model to specifically include endoplasmic reticulum stress. And I've got some diagrams in the book to help you understand that. Now, the updated information in this second edition actually comes directly from my functional inflammology textbook. So if you have the functional inflammology textbook, I would say you probably don't need this book because you already have that information. However, if you want the presentation slides, then either the first or second edition would be a reasonable addition to your library. And as you can see at the bottom of the page here, I provide a discount code. If you want to go ahead and get the new book, you can do that at a discount and it won't cost you as much as full retail. So my goals for this presentation were to help you look beyond acute infections to understand how these latent, clinically invisible infections can actually promote chronic disease and mitochondrial impairment, to show you how the prediction that I published last year has now been substantiated by new data, to show you how to reconcile the ApoE genetic predisposition for Alzheimer's dementia with a model that also includes viral replication and mitochondrial dysfunction. And then, of course, to show you that we do have antiviral protocols and strategies that have excellent research and clinical substantiation behind them. Summarizing the major points, we have to consider the total viral load whenever we consider viral infections, to look at the new data, which we've already done, and to emphasize the role of these viral infections in mitochondrial impairment. So again, we all, of course, want to help our patients improve their mitochondrial function for the treatment of various different conditions, whether it's fibromyalgia, chronic fatigue syndrome, hypertension, diabetes. But what I want us to consider in this presentation is that we need to look beyond simply providing patients nutrients. We need to look at the actual microbial causes of mitochondrial impairment in a lot of these patients as well. And again, for that reason, I've recently updated my antiviral protocol. So thank you for your attention, and I hope you'll take a look at these new antiviral strategies and how we can implement these in a very logical and effective and scientific manner to improve outcomes, not only in our patients with acute viral infections, but also in patients who have these chronic, long-term, long latency virus-induced disease states.